audience. And if you have additional questions, let me find out if we have time. Do we have time for additional questions? One more question. Okay, so I'd love to entertain one more. Thank you.
Hello, my name is Janelle Redmond. This is for our viewers, for anyone that can answer the question. For those people that go to DC jail or go through drug treatment programs and they have providers, is it all right for them to change the medication? And as us being on HIV medication or either hormone treatment, do we notify our provider or do we just sit there and trust the person because they are certified to be a doctor to change our medication?
It would be better if whoever, if you find yourself in that situation, it would be better for them to consult with your medical provider to find out why you're on what you're on in the first place. You know, if you're incarcerated or in a place where you're going to be there for a long time, if they have all your medical records and all the information about, you know, what your medical history has been, they may be okay to change your medication. But if they don't have that information, they should probably change it without consulting, you know, with the person who is treating you and put you on medication for a certain reason. That's what I would say. I think they should consult with your medical provider before they do that.
If they do not consult, like, should we take into our hands the right y'all or even call y'all ourselves?
If you can, you can do that. Mm-hmm.
So we have time for one more question.
I don't know if you mentioned it would be in your opening remarks, but you told us, some of us last week, Ruby, are you tweeting out on your program with the Department of Health? Can you talk about that in terms of bringing people into care? One thing I heard tonight was about people going into incarceration, sometimes without medical histories, who have self-medicated on their own, you know, what's for them. And Ruby's program, with particular emphasis on HIV, I'd like to hear more about her strategy and other strategies to bring people into care who aren't in the system, you know, who have so much going on in their life, you know, to get to even an application, you know, it's like a huge mountain you have to climb. So, I didn't want the night to end without talking about some of these strategies for people.
Well, thank you for actually stopping my tweet. It was not my tweet. I have someone tweet for me because I don't even know how to tweet. But that's where volunteers are great. She's a great tweeter. So yeah, I do have someone who manages all my social media. But you know, that was one of the reasons when I opened Casa Ruby. I wanted to do things that were different. And I wanted to do things that other people had not tried in terms of, you know, helping people. And you know, there has been a lot of things, and one of the things that woke me up was that for many years, you know, me and Arlene and a few others spent so many years picking up bodies. Really, that's where we were spending a lot of our time, because we come from a time where violence was just so much that every day was, you know, I have to go to the hospital. The next day you have to go, you know, and clean up, you know, an apartment on Kansas Avenue because someone had been shot. And the next day, you know, you have someone has been robbed. I think in the last couple of years we have actually been able to breathe because we do have other people that have stepped up. I'm very grateful to have worked with the DC Trans Coalition, who's made so much change for trans people in the city, and took, you know, a lot of that from me and Arlene and others that were basically healing people. But just to answer that, my whole concept of Casa Ruby is three things. First, you have to come in if you're wounded or if you need healing. It's the safe space, and that's where I actually have the social services. And those are directed to people who really need to get out of a dangerous situation or or simply, get them at a time in their life where they can really dream again. Once they're there, I actually focus a lot on education, and that is where I'm spending a lot of my time. I am working on making Casa Ruby the first LGBT training facility in the city, because we were able to work with the mayor when he first came into office, and he was the first one who actually put things on the table for us. We graduated, me and Arlene graduated 40 people out of Project Empowerment. And unfortunately, that was really not the true answer, because it was a training program, but our people were not trained. So that's really where I'm focusing. For 2013, that is one of the announcements that I'm making. We are going to be providing training for people that need and focusing a lot of employment. I'm doing a lot of work with the Department of Employment Services, with the Office of LGBT Affairs, and other people that are collaborating with me in creating curriculums that are going to be useful to people. I like to test everything before I put it out. I am graduating on December the 1st. 50 medical screener technicians at Providence Hospital, and that is something that I've been doing in the Latino community. This time I integrated LGBTs, and out of the 50, 17 are LGBTs, including almost 8 transgender women. So I know it works. So I have a curriculum. I need actually now I had a meeting with the Office of the Superintendent, because I'm seeking to have a license. So our trainings are actually accredited, can actually be used for people to get licenses like home health aide, CNA, medical assistant, phlebotomy. So it's a long process, but I'm actually getting started. And I invite any one of you who may have some skills to be part of this task force that I'm creating, because we got to provide people with training. We got to provide people with an opportunity. So when they do go to projects like Project Empowerment, 100% of the ones that go come out with employment. Because I have seen, and me and Arlene have seen, when people have education, they can actually do great things. So that's for starters. Second of all, I also focus on health promotion. And we are not an HIV center, we're not an HIV clinic, so we do a lot of preventive and what is called preventive health. And the medical screeners are actually becoming health promoters. And I am embarking on an adventurous thing in 2013. The 50 people that are graduating, along with the other ones that we are going to be doing in 2013, I want to reach people where they are. I want people to go to the strolls, to those health, the people who do the health promotion, to go to the strolls, because that's where I actually became very aware. Me and Arlene used to go to the parks, and we used to go to the strolls, and we were running all over the city. And that's where I really, saw a lot of what needed to be done. So I want to integrate all of these things, and I don't want to take all of the time. I do want to invite people who want to be part of the team. I work mostly with volunteers. Right now, I have 12 people on staff, which means they work full-time, including 4 African Americans. We have 2 that came on board. So we really are planning a lot of great things. But I need more, because the one thing I know and I realized when I opened, 250 people showed up to the grand opening. And in the last 3 months, the last 5 months, we have provided almost 3,000 direct services. Some of them are repeat, but it is easy, and I know that I cannot do this alone. So I want to make the invitation for anyone who may have 1 hour a week, or if you have more, to please stop by and learn about what we do.
Thank you, Ruby, for the fabulous work that you do. DC is a better place for the trans community, thanks to Casa Ruby and Ruby's longtime activism. So on that note, I want to say thank you to everyone on the panel who's obviously committed to community activism, community work, community education, and making things better for all of us. So I want to say thank you again to everyone for your time, and thank you.